Enjoying life once again after testing positive can be tough. But current HIV treatments and supportive care has ensured that HIV clients live longer lives, enjoy sexual lives, and lead productive lives. Having an HIV client in your family is tough, and most people don't know to live with them safely. In this video, I will answer this question from one of our viewers. The question is, how to live with an HIV positive person? In this video, I will also teach about 1. What to do when a person you know tests HIV positive. 2. How can you help someone who just tested positive for HIV? 3. Medications HIV prevention. 4. How to care for HIV positive family member. 5. How to have sex with your HIV positive partner. If you're new to our channel, subscribe today so that you don't always miss our new health tips we post weekly at Mark Medicals. Alright, let's get started now. 1. What to do when a person you know tests HIV positive. Having a loved one test positive strikes fear, confusion, and regret in the family and may force people change ways they used to relate. What you need to know is that HIV is not transmitted by just casual contact like sharing cups, plates, fork, sharing same bedroom, etc. HIV can only be transmitted from blood to blood like having unprotected sex, sharing syringes as in drug abusers, and sharing other sharps with blood stain. So, stay calm and continue treating him or her the way you used to do. 2. How can you help someone who just tested positive for HIV? Talk to them and assure them that they remain treasured the way you used before. HIV is not a death sentence. People with HIV can nowadays live to see their grandchildren just like others. Be open to them, and if they don't want to share with you, respect their opinions. Don't push them to tell you stuff if they don't feel comfortable with that. Another thing is that, if you are living with someone HIV positive, educate yourself on few basics about HIV. You need to know bits of HIV prevention measures, bits of HIV symptoms, and bits on HIV treatment. By doing that, you will know surely how to offer best support and care. To learn more about HIV, we have many videos at Mark Medicals on YouTube. Go teach yourself all the HIV basics from our channel. 3. Medications for HIV prevention. HIV medications is paramount in survival of all HIV clients. Without HIV medications, the client will soon develop AIDS and die of the HIV. It's good that, currently, people with HIV can live productive lives, and they are as healthy as their counterparts who are HIV-free. HIV has no cure, and someone needs to be on medication for life. If your partner is HIV negative, then he or she needs to take PrEP only if both partners decide to continue having unprotected sex. PrEP is medicine taken by any HIV negative person to prevent HIV infection if one of the partners is positive. Also, for the positive partner not to transmit HIV, his viral load should be suppressed or undetectable. If you think you have been exposed to HIV from your partner, talk to your doctor for PEP-HIV medicines within 72 hours. 4. How to care for HIV-positive family member? As said earlier, HIV can only be passed from blood to blood. HIV cannot penetrate through intact skin, and therefore you will not get HIV from just casual contacts or touches. Make sure you don't touch blood, vomitus, or any body fluids with your bare hands, as you may have small unnoticeable wounds or cuts on your hands. You will need to use some gloves to handle any bodily fluids, like blood and vomitus. Ensure proper hand washing after every caring for client. 5. How to have sex with your HIV-positive partner. If your partner has been on HIV medicine for more than 6 months and has been taking medications religiously, he or she shouldn't know any HIV virus circulating in his or her blood. This is called viral load undetectable or suppressed viral load. If the viral load is suppressed, such HIV client will not infect his or her sexual partner. This can also be summarized as undetectable is equals untransmissible, or U equals U. What you need to know is that the HIV-negative partner too needs to be on PrEP HIV medications to reduce the risk of HIV infection even more, only if the couple chooses to have unprotected sex. Thanks to current medical interventions, you can have children and enjoy sexual life despite one's HIV status. Conclusion: caring for an HIV person in your family doesn't put you at risk of any HIV infection. Just make sure you don't touch his or her body fluids with your bare hands. If the client is your partner, make sure his viral load is undetectable. You too who is HIV negative should consider PrEP HIV medications. Thanks for visiting Mark Medicals. Please subscribe today.